Hello class, this is Labria and I'm going to talk to you today about HIV and AIDS. So a little bit about the disease. HIV infection is a primary immunodeficiency disease caused by the human immunodeficiency virus, hence the name. There are two types. HIV-1, the point of origin is Central Africa, and this one is more severe. HIV-2, the point of origin is West Africa and it is less severe. As far as prognosis goes, HIV, if untreated, can lead to AIDS or acquired immunodeficiency syndrome. There is no cure, but with medication and lifestyle changes, you can reduce the progression of the disease. And some other facts about HIV is that it originated from a chimpanzee in Central Africa, and it may have been transmitted to humans in the late 1800s, and it existed in the US since at least the mid to late 1970s. With etiology, like mentioned before, it is an infectious disease caused by the human immunodeficiency virus. It spreads via sexual contact, through blood, from blood transfusions, in which the risk is small due to the procedural testings of the blood before they engage in the blood transfusions, and through sharing of needles with contaminated IV drug paraphernalia. It also spreads from mother to child during pregnancy, childbirth, or through breastfeeding. Now, when HIV turns to AIDS, there is an increased destruction of the CD4 plus cells, which are the white blood cells, and you can even have the infection for years before it turns to AIDS. And AIDS is diagnosed when the CD4 plus T cell count falls below 200. It is also important to note that ways in which HIV does not spread due to the stigma of, some people, they hear, oh, this person has HIV, so, they don't want to get near them. They're afraid that they may get HIV, which is not true. So some ways that it does not spread is through hugging, kissing, dancing, or shaking hands with an infected individual. So as far as what's going on inside the body, the pathogenesis, it starts with an infection of the mucosal tissues. Then you have death of mucosal memory CD4 plus T cells. There's infection established in the lymphoid tissue, the lymph nodes, and then there's a spread of the infection throughout the body. So then there is then an chronic infection that leads to increased viral replication, and then AIDS occurs when there's destruction of the lymphoid tissue and depletion of the CD4 plus T cells. So I included some visuals here for our visual learners, indeed, which I am. So here is a HIV particle. It's an HIV particle with the RNA enclosed inside of it. And so this diagram here is basically showing the early stage of HIV being infected into a host cell. So you have the HIV particle here, and it binds to a CD4 receptor. And then it has a co-receptor, the CCR5, that helps with the passing of the HIV virus into the host cell. So then it slowly is occurring here, and then you finally have the DNA, RNA makeup that gets injected into the host cell and causes the infection. So a little more graphics here. So you have the HIV virus that fuses with the cell, in which this is the CD4 plus cell, which is the white blood cell. So then you have the viral RNA that migrates to the nucleus, and this is where the reverse transcriptase transforms into DNA. And then you have the messenger RNA that occurs after leaving the nucleus. And then you have the viral proteins that are produced, and eventually the HIV virus exits the cell, which then, it replicates and it goes to infect another host CD4 plus cell. So some symptoms of the disease include night sweats, mouth ulcers, fatigue, chills, muscle aches, rash, fever, and swollen lymph nodes. So important risk factors that I felt was important to include are unprotected sex, if you have an STI, sexually transmitted infection, and this is because a lot of these sexually transmitted infection, the result of them leaves open pores, open sores, in which the virus is then easily transmitted into the body. And then another risk factor is the use of IV drugs. So as far as prevalence goes, in the Saharan Africa, 24.8 million people are affected. In Latin America, 1.7 million people are affected. And in Eastern Europe, 1.5 million people are affected. And in Central Asia, 5 million people are affected. So in the United States, there are more than 1.2 million people affected, which is greatly different than these other areas in which people are affected. And that's because in the US and other industrialized countries where access to medication care and prevention is greater, there's also a number of patients who are diagnosed with and they're dying from AIDS. This number is more stable and it's declining more. Other countries have more limited access to testing and medication for treatment, as well as limited information for prevention. And that's why, some of their numbers are higher than those in the United States. So some key numbers and demographics. All of these numbers came from our book, and there may be some differences when you try to Google them, but I did refer mostly to the book for this portion. So 36.9 million people are living with HIV worldwide as of 2014, and then there are 1.2 million AIDS deaths. There are 34.3 million adults affected with HIV, and of that, 17.4 million are women, and 2.6 million children are affected that are less than 15 years old. So as far as race and ethnicity goes, the racial and ethnic minorities and women of color are more affected. 41% are African Americans, especially in the young age group, and 20% are Hispanics. And in the Northeast and South, they report the highest number of HIV and AIDS diagnoses. The South reports 45% of new AIDS diagnoses. The Northwest reports 24%, the West reports 19%, and the Midwest reports 13%. So as far as diagnosis goes, there are different methods to diagnose and test for HIV. So for the CDC recommends HIV testing as part of routine care for all adolescents and adults. And as far as females go, when you go to get your annual pap smear, they do offer HIV testing as well during that time. And the FDA approved various methods, including rapid HIV assays that use blood, serum, or oral secretions with results in little to 20 to 30 minutes. So with that, the positive results must be confirmed by further laboratory testing because you can get false negative tests, especially in the initial period of the HIV infection. So it's good to get those laboratory tests done with these quick testings results. So then you have serum and plasma specimens tested in approved labs using HIV-1 and 2 antigen antibody combination immunoassays. So more specifically, there's one, the ELISA, the enzyme-linked immunosorbent assay, that is used to detect the HIV antibodies. So when this test is positive, then they use the Western blot test to confirm the presence of HIV antibodies. So again, there is testing and then retesting to confirm those results. And then in neonates, the best method is to culture the virus from blood and peripheral tissue. So here's a list of a lot of tests that are used to diagnose and to monitor the progression of HIV. There is a lot here. A few of them to mention are the CD4 plus count percentages. A lot of these panels, chemistry panel, lipid panel, energy panel, and another one to point out is the gonorrhea, chlamydia, and trichomoniase testing. This again is done because of the co-occurrence of STIs with HIV. Then you also have renal or abdominal ultrasounds, and then you have your pregnancy testing due to the mom's ability to pass it to the child, and TB screenings, blood cultures, things of that nature. So here's a complete list of all of those. So as far as treatment goes, there are antiretroviral therapy recommendations. There's use of multiple medications, which is also known as HART, that involves administration of multiple antiretroviral agents. So other treatment methods include taking NRTIs, nucleotide RTIs, NNRTIs, protease inhibitors, fusion inhibitor, CCR5 antagonists, integrase transfer inhibitors, and then there are other treatments and vaccines, including antibiotics, antivirals, antifungals, antiparasitics, and mycobacterial medications. And some of the more common antivirals that may be seen on some of these commercials that we see include Biktarvy and Dovato. And then we have vaccine-conferred active immunity. So the ultimate goal of current research is this vaccine-conferred active immunity, but this task is extremely difficult because of the HIV strain variability and HIV mutation frequency. So none of the vaccine trials have been successful, and several have been stopped in phase 2 because of this, frequent mutation of the virus. And at this time, there is no effective vaccine available for the prevention of HIV. But like I said before, a lot of if people end up with HIV, there are a lot of medication and lifestyle changes that allow people to live very long lives with this disease. So here are my references, and I look forward to answering all of your questions. Feel free to ask me anything. I will try my best to be as thorough as possible. And thanks for listening and watching.